110. Another COVID surge that wasn't. Watch a journalist cover her tracks. February 8th, 2021. You know how it works by now. According to our opinion molders, any movements in the COVID numbers are a reflection of the compliance or otherwise of the public with the state's so-called mitigation measures. Now, if we had any actual journalists, some of them would observe the absurdity of all this. After all, societies with little in common and remote from each other have seen exactly the same curves. We're supposed to believe that this is because their peoples all complied and then didn't comply and then complied again on exactly the same timetable? Can people be this thick? Thus, Elaine Godfrey at The Atlantic just wrote, quote, "In November I wrote a story about how COVID-19 was overwhelming Iowa's hospitals. Back then, public health experts predicted another big surge after the holidays, but it never came. I went back to those experts to find out why," unquote. She went back to those experts to find out why. She'd better follow up with these people who were totally wrong, ask them why they were totally wrong, and then uncritically repeat their answers to her audience. Now, of course, she could have consulted people who have been right and who have been critical of the public health apparatus to see if maybe these folks have some insight into why the always wrong people were wrong yet again, but that would be journalism, and that is not Elaine Godfrey's field. Instead, she wrote a follow-up article called "Iowans Were Scared into Taking the Virus Seriously." Yes, this is the best she can do. Public health officials did such a good job panicking everyone about a surge that they persuaded people to change their behavior. Know what the trouble with this is? Iowan public health officials must have been so effective at scaring people that all the scariness spread into North Dakota, South Dakota, Nebraska, Minnesota, Missouri, Illinois, Montana, Wyoming, Colorado, and Kansas too, which had identical curves and declines in their numbers with no change in public health messaging and no change in the public's behavior. Oops. They also try to claim that Iowa's November mask mandate brought the numbers down. But again, why the simultaneous declines in so many other places? Not to mention, you've seen the charts I've shared in country after country and state after state. We got masks flattened the curve in the first half of 2020. And then in the fall, with mask compliance higher than ever and the numbers worse than before, total silence. They can't possibly admit that none of it worked, that our feeble interventions seemed to do nothing to prevent people from becoming ill. They can't admit that they depleted people's savings, caused millions of avoidable deaths, and ruined people's lives for nothing. So it always has to be the numbers came down because of our wise policies. When the numbers skyrocket with those same policies still in effect, or even increased in severity, that's supposed to be the fault of the vanishingly small percentage of non-compliant folks. Meanwhile, California's death numbers, 118 per 100K, are approaching Florida's 129 per 100K, even though California has one of the country's youngest populations and Florida one of the oldest. And therefore, Florida's numbers should be vastly worse, not trivially worse. Not to mention, Florida has been open with no state-imposed capacity restrictions since September and was mostly open before that. How is this possible if the cartoon version of events is correct? Human happiness is not an optional extra. Our lives should not be at the mercy of governments operating from bogus science to be turned on and off at whim.